Initiatives webinar series. We'll be talking today about transition preparation, and I'm so pleased actually to be presenting with Michelle Jiggets, who is Program Administrator, Complex Care Program and Parent Navigator Program at Children's National Health Systems Goldberg Center. Please go to the next slide. So our disclosures are that we don't have any disclosures. And Got Transition is a program of the National Alliance to Advance Adolescent Health and is funded by the Maternal and Child Health Bureau of HHS. Next slide, please. Just to remind those who may not have been on the first one, the Got Transition's webinar series goals are really to support State Title V implementation and measurement of healthcare transition in care coordination programs, guide the care coordination program's improvements by sequentially building on the evidence-informed 6 core elements. We're starting that today. Share promising practices from State Title V supported care coordination programs. You're going to hear from Michelle Jiggets today as an example. It's 5-session webinar series, and the webinars and handouts will be available following each session at gottransition.org. Next slide, please. So at the conclusion of this particular webinar, we hope that you'll be able to really identify key components of a healthcare transition policy for care coordination programs that families and youth want to know, customize a transition readiness assessment for care coordination programs, pilot and disseminate a healthcare transition policy and readiness assessment, incorporate a readiness assessment skill needs into a plan of care, and educate youth and families on needed skills, and prepare a medical summary and emergency care plan with youth and families and their providers. Next slide, please. At the end of this webinar, they will have some handouts that will become available. Obviously, one will be the slideshow. Next will be an iPhone and Android information sheets. These are things that I'm going to talk about during the webinar. We got transition readiness assessment, youth with intellectual and developmental disabilities and parent readiness assessments, and a medical summary for youth with intellectual and developmental disabilities. Next slide, please. So just for those that didn't make it to last month's webinar, we talked about clinical foundations. We also talked about performance measurement in this process, Title V baseline assessment, what is everybody doing out there today? And then starting a healthcare transition pilot using a quality improvement and the core element processes. So I encourage you to go look at those if you didn't have a chance to join us last time. Next slide, please. So this is giving you the beginning of the clinical foundations and the 6 core elements of healthcare transition. There are actually several different packages available. Today, we're talking about the one for youth that are transitioning to an adult clinician. You can see all 6 of them here. There's a transition policy that starts around 12 to 14, or whenever you feel your transition process is going to begin. You want to do transition tracking and monitoring. This can happen throughout the process, but perhaps we'll start around age 14. Then you want to do a skills assessment, a readiness assessment. Then you'd like to incorporate that into transition planning, as well as having a medical summary. Then there's the transfer component to an adult-centered care, and also integration into an adult practice. And then finally, 6, you're talking about confirming that completion and eliciting consumer feedback as they're incorporated into the adult practice. Next slide, please. This is just a visual to let you know that there are many tools. We're only going to be talking about a few of them as we go through this. Next slide, please. So we're going to start with transition policy. Next slide. So what is the purpose of the core element number 1 policy? It really is to formalize the care coordination program's approach. Reduce the care coordinator's variability when they're talking about healthcare transition, and offer a transparent approach to youth and families. Youth and families really like this as one of the core elements. It really is tells them explicitly about the plan and sort of gives them a chance to think about planning early on and throughout the process. So what's in this policy? Well, you're going to define the program approach and the recommended ages for transition preparation. And then in the beginning, then when you're going to adult focus care, and then if you're going to be staying in the pediatric side beyond age 18, what the transfer is going to be like, how the program is going to support them in this, and then how it's going to support them in integration into adult care. It should clearly clarify an adult approach to care and the legal changes at age 18 so everybody can think about this. And in many of these instances, you're going to have to think about decision-making support potentially, or even guardianship potentially. Since it's being shared with everybody, the reading level has to be appropriate. The ones up on our website and we're talking about are all about reading level grade 7, but we've dropped them down to grade 5. And you should communicate this policy to everybody and begin it at an early age. Next slide. So what are the challenges in doing this? Well, how do you establish your written healthcare transition policy? What topics should be included in a policy? You should think these questions through. When are you going to start this? What are the support systems that you're going to offer? When is it likely that they should be going within your system to an adult office? And those are the kinds of things you want to be thinking about. And then how best to get youth and family caregiver involvement and feedback. You want them to review it with you in your particular group of patients that you're caring for in your care coordination program. And then who are you going to share it with? Ideally, you want to share it with everybody, but you might have some people that you particularly want to focus on as you're going through this. Next slide, please. Next is core element number 2, tracking and monitoring. Next slide. So here you're trying to facilitate systematic data collection to improve quality at the individual and population level here. So you're thinking about having some kind of way to document sort of the demographic and diagnostic complexity data along with when they received each of the core elements that you've decided to offer in your program. For example, when the policy was shared, when the readiness assessment was administered. So you can do this. We offer a paper checklist or an Excel spreadsheet for an example up on our website, but many people put this into their electronic health record. Next slide, please. So what are the challenges? Well, you have to decide what information should be tracked. You want the name, the date of birth, the complexity, diagnosis, the data receipt of each core element. Then there may be something else that you might want to add there. And then what options are available to track and trigger the use of these core elements within the program? How are you going to get everybody to think that if you've decided everybody should get a readiness assessment at age 14, how are you going to remind people that that's what they need to do? Next slide, please. Now, here comes transition readiness. Next slide. This is just a fun cartoon. First, they make you button your shirt, then they make you tie your shoes, and you got to ask yourself, where is this all heading? Now, what you don't want is having your families and youth in your program asking, where is this all heading? You'd like them to begin this process and have a sense of where they're going so that they'll be easily able to plan and not be so anxious about the whole process. Next slide, please. So transition readiness, the purpose here is to assess the youth's skills to manage their health and healthcare in the adult approach to care. The content should rank importance and confidence in their importance, how they see changing to an adult provider before the age of 2. For example, you also could rank importance of self-care management or confidence about ability to changing to an adult provider. It assesses self-care skills related to their health and using health services. Our particular one has some generic questions, but the idea is that you could easily customize it and add more as you think is appropriate for the youth and families that you care for. The idea here is it would be completed several times during the transition process. It's used as really a discussion tool here to plan the skill building education that's you'll reveal through doing the readiness assessment. Many people wonder that if they score 100% on the transition readiness assessment, somehow that's going to predict transition success. Well, sad but true, the readiness assessment is one of many components to transition success, so it does not predict that. And you clearly want to customize it to meet the needs of your programs, or if you're talking with a practice, their population. Next slide, please. Next slide. So there's some strategies to help youth think about knowing their health information, which is a big piece of what goes on in a health readiness assessment. I'm sure many of you have iPhones or Android phones. Certainly the majority of youth, young adults, and adults have a cell phone today. And on an iPhone, there's just a health app sitting right on the desktop of the phone. And you can easily add in health information such as their diagnosis, allergies, medications, but the key number is who to contact in an emergency. It should be accessible without a passcode for access, and we have actually uploaded for after this some forms that you can actually use to help people do this, whether they have an iPhone or an Android phone. It clearly facilitates their ability to communicate and keep track of this health information. I use this all the time, and young people, when they come in, I say quickly to them, can you tell me your diagnosis, your drugs, and your allergies, and do it quickly? Many of them have a little bit of difficulty, but they know it's in their phone, and they just bring out their phone and they're confidently can show it to you. So I think it's a very good way, and I encourage the parents to have this as well. Everybody should have this, because clearly if you're unable to communicate and EMS finds you, they're not going to be looking for the purse or the wallet. They're going to be looking for your cell phone. Next slide, please. Now, there are some customized forms that were actually put together by the American College of Physicians Council on Subspecialty Societies. They worked with us in 2016 to customize 6 core elements: transition readiness assessments, self-care assessments, and a medical summary for selected conditions. The teams included representatives from pediatric and adult professional and patient groups. There is one general medicine with a group of them, put one together for those with intellectual and developmental disabilities and physical disabilities. And then you can see a list here of the subspecialty diseases that have already been uploaded onto our website. You can connect through, or it's available at the ACP website. These are very helpful if you have particular young people with these diseases, to think about what's the information that they need to know as well. Next slide, please. This is just an example of the transition readiness assessment for youth with intellectual and developmental disabilities. It has been customized. As you can see at the top, it says legal choices for making healthcare decisions, and then about their personal care. Next slide, please. So what are the transition readiness challenges? You have to think about what skills about health and healthcare are important for your clients to know. How can youth and family and caregiver involvement be really worked through as you show it in a PDSA cycle for feedback for them? When should this readiness assessment be assessed? Are you going to do it at age 14, begin at 16? How often? And then who do you think is going to complete this? The ones that we've been showing you from Got Transition are really set up for the youth themselves and the parents to fill out. But perhaps in your program, the care coordinator will administer the readiness assessment. So you have to think about the answers to all these questions as you look at some of the readiness assessments available and are going to customize them. Next slide, please. Now we're coming to the fourth one, which is transition planning. Next slide, please. So you really want here to establish between the youth and the family and the care coordination and or the clinician about a set of actions to address priorities and access to current medical information. So you have a lot of people to coordinate here to be sure that you're meeting the needs of your young person in your program. So you want to identify what matters most to youth in becoming an adult beyond health goals. Our young adult groups really impressed upon us as we put this together that no, their goal shouldn't be that they should control their blood sugar, but know that they would like to control their blood sugar because they want to go to the prom. You have to really think about what is the goal, or they want to go to college, or they want to do something. So you want to be clear about what it is they've told you, and then weave how that health need that they should meet fits into that. You want to define how learning about health and healthcare supports their overall goals. And I think it's adding this readiness assessment skill needs to the plan is going to be key here. And as I mentioned previously, the ACP project developed a plan of care templates for intellectual and developmental disabilities as well as physical disabilities. So I think that's helpful. Also, you want to complete a portable medical summary, a short one, in some format, and an emergency care plan that includes what we call special information. That's really non-medical information that can be shared, that the young person wants to share with their new provider. There's nothing better for me as a new adult provider seeing a young person that I can say, it's wonderful, I've spoken to the pediatric provider, I have your medical records, and I understand, since I've been told by the pediatric provider, that you are great at whatever it is. Playing the violin, I have no idea what it is. But there's nothing better than doing that. It relaxes those first few minutes, and they're more likely to want to follow up with the new provider. Next slide, please. This is really an example of how concise you can make this medical summary emergency care plan. This is the example from young adults with intellectual and developmental disabilities that was put together. You can see the different, the disability checklists and so forth that you can add. And this is very helpful for people to have and have available. If for some reason they go to the emergency room and then would have something about themselves to tell others. Next slide, please. So what are the challenges? Well, how do you actually get incorporate healthcare transition into if they already have a fairly complex plan of care, which is likely for many of the young people that are in your programs? How can you get youth and family and caregiver involvement and feedback on this plan of care as you're going through it, and also coordinating it with the provider that's taking care of this young person? And how can the care coordination program help this healthcare provider to complete this medical summary and emergency care plan? Sometimes everybody's busy and you need to help them to think about how to put this together. And then who's going to provide the needed self-care education? If they don't know how to do something, such as what should they do if their doctor's office is closed, rather than going to the emergency room, what should they do? They need to learn about it. So this kind of education, you have to decide who can provide it once you've found out what the skill is that they need. Next slide, please. So now we have the wonderful opportunity to really think about an example. So, what are you going to do, where to start, and you're going to hear a wonderful example. So I'm going to turn this back to, next slide, to Dr. Lindsay, who will be introducing Michelle Jiggets. Dr. Lindsay?
Hi, can you hear me?
Yes.
Okay, great. Hi, everybody. As Dr. White just said, my name is Jen J. Lindsay, and I'm the Deputy Director for Policy and Programs for the Community Health Administration at the DC Department of Health. We've been recently rebranded as DC Health, so if you hear that name, that's what that is. In my role, I also serve as the District of Columbia Title V Director. In DC, our Title V program supports transition strategies as a way to ensure that our adolescents, particularly those who are most vulnerable to poor health outcomes, remain engaged in primary and preventive care as they transition into adulthood. We currently support 2 efforts through grants with longtime partners, the National Alliance to Advance Adolescent Health and Children's National Medical Center, specifically the Goldberg Center within that organization. The Alliance has got transition staff is working with various healthcare systems and provider training programs to introduce the 6 core elements of healthcare transition. This also includes piloting transition services in our school-based health centers, which we think is kind of neat. The Children's Family Navigator program helps empower families with children with special healthcare needs to better access and coordinate care, advocate for their child's needs, share medical decision-making, and transition to adult health care. The Family Navigator program was developed and is currently operated by Dr. Michelle Jiggets. Dr. Jiggets is a pediatrician with more than 20 years of experience serving families of children with special health care needs. She is co-investigator in the Center for Translational Science at Children's Research Institute in Washington, D.C., on a research study examining the parent and provider perspective on the Parent Navigator program. Dr. Jiggets recently served as research coordinator in an ongoing Patient-Centered Outcome Research Institute, or PCORI, funded project that examined the impact of integrating parent navigation into a NICU setting, facilitating the intervention component. With that, I'm going to turn this over to Dr. Jiggets, who will describe her innovative efforts to introduce healthcare transition with a population of youth with special healthcare needs.
Thank you, Dr. Lindsay, for that introduction. And on behalf of the Children's National and the Parent Navigator program here at Children's, we would like to take this opportunity to say thank you to National Alliance to Advance Adolescent Health for inviting me to share with your audience about how parent navigators are making the transition connection in the District of Columbia. Next slide. So here are just a few objectives of this presentation. We're going to give you a little bit of history about the Parent Navigator program, the role that parent navigators play as it relates to transition, a little discussion around transition integration into our medical home setting using the 6 core elements, and then identify some next steps. Next slide, please. Our program was founded by Dr. Carabetto, one of our primary care pediatricians, in 2008, with initial support from DC Health, Community Health Administration, and then later we received some funding support from Maryland Department of Health and Mental Hygiene through the Office of Genetics and People with Special Health Care Needs. And this funding has all allowed us to provide better wraparound services for children and youth with special health care needs through our Parent Navigator program, which is housed inside of the Goldberg Center for Community Pediatric Health. It is our Children's National Center of Excellence. Our program consists of parent navigators who are parents of children with special health care needs themselves. And the program originally started out with 2 part-time parent navigators, and we currently employ 6 full-time navigators. Here's a picture of our navigators. We are missing one of them, but this shows some diversity in our staffing that we hire to be able to provide support services for our families that we serve here at the hospital. Our navigators provide these services to these families who are receiving care through one of our primary care sites. We have 6 primary care sites that are located, 2 in the hospital and 4 in the community, or through our complex care program. And our complex care program provides care coordination services strictly for children with special health care needs. 2 of our navigators are bilingual, so we are able to serve our Spanish-speaking families as well. Next slide. The Parent Navigator is a key member of the medical health care team, and this diagram illustrates that the navigator is an integral part of the medical fabric that interfaces with the family as well as other entities that our families will come in contact with. So at any given time, navigators will work closely with school administrators. They may work closely with the insurance case managers, community agencies, hospital specialists, in an effort to help our families to become more successful. Next slide, please. So the roles and responsibilities of our parent navigators is to provide peer-to-peer support to other families of children with special health care needs, and that they reside, for those families that are residing in the DC metropolitan area. Our services are customized based on the individual needs of the family, as well as based on the needs that have been identified by their pediatrician. So our navigators engage in coaching families on how to advocate for their child, how to communicate more effectively with their healthcare providers, how to navigate services within the hospital as well as in the community. They link them to educational resources, helping them to understand their child's educational rights as it relates to their IFSPs and IEP and 504 plans. They provide a lot of follow-up and family support, as well as starting the preparation to preparing our families for transitioning to adult health care services. Next slide, please. In serving our families, we have recognized the importance of integrating a standardized process to better assist with transitioning medically complex teens. And many of these young adults are followed by multiple subspecialists, and they may require transitioning for both primary care as well as subspecialty care services. And because of these two entities, it proves to be a very difficult challenge for our families to coordinate. And so hence we feel that parent navigators, since they are already intimately involved with working our families, that they can in fact help to coach our families through this process as well. And so as a result, within our patient and family-centered medical home, we have formulated a transition team comprised of a program administrator, parent navigators, and physicians from both our primary and our adolescent departments. It's important for me to mention really at this point is that we have had the support of our executive leadership in the Goldberg Center, who encouraged our teams to facilitate this process. And so sometimes I realize that other agencies or organizations may not necessarily have that support, but we have been, it's been a benefit for us to have that support, that ongoing support from our executive leadership. We were instrumental in coordinating bi-weekly meetings focusing on transitioning and our daily activities. One of our initial meetings involved Patience White and Peggy McManus, and they came to help us educate our staff on the 6 core elements and to provide tools that were geared towards transition integration. Next, we asked our medical directors of all 6 of our primary care sites to complete a self-evaluation assessment for their individual facility, because we needed to know what was happening in each one of those facilities so that we can kind of streamline it and have some consistency and some standardization. The results clearly validated that there was a need for improvement in how we deliver transition services to our families. Next slide. So this is one of the tools from Got Transition that we use to do our self-evaluation. And we really did not make it very high in our number here. So we knew that all of our sites were at different levels in the process. And so we needed to figure out a way in order to streamline that system. Next slide, please. The information that we discovered from that self-evaluation, it was used to design a process for implementing the 6 core elements and identifying how navigation could be instrumental in putting the pieces together at all 6 of our primary care sites. So the next few slides are going to demonstrate how the navigator's role has been in executing these elements into our daily practice. Next slide, please. Transition policy. We actually tapped into the transition policy that had already been developed by our adolescent department, but made sure that it was uploaded to our intranet for our staff to view. We wanted to make sure that we were increasing staff and provider awareness. We focused on educating our management staff as well as our adolescent health providers on the particulars of the policy. And that all children, starting at the age of 14, navigators will begin to actively discuss the transition policy during their first initial contact with that parent navigator. So any child that we come in contact with on that first initial visit or communication, we will in fact discuss that policy with them. Next slide. Transition, tracking, and monitoring. This is the second core element. We established criteria for identifying eligible teens and developed a process for assessing them. So one of our criteria is that the teen must be between the ages of 14 and 21 years of age, and they must have a diagnosis that consists of either autism, developmental delay, or they have a complex medical need such as extreme prematurity or a chromosomal anomaly. They may be tech-dependent, G-tubes, trachs, have hydrocephalus, and these are just to name a few of the type of families that we actually serve. We formulated a process which involves receiving a weekly list of eligible teens with upcoming appointments within one of our 6 primary care sites. So that information is pulled from our electronic medical record system, and it gives us a list of all our upcoming appointments so that we have a better access to reach our families. That list that we receive on a weekly basis, it is then divided up among our navigators according to an alphabet system. So a navigator number 1 may receive the letters of A through F and so on. We have also created a registry to track our transition planning activities, which has seemed to be very, very useful, particularly when we move from one year to the next. Next slide, please. This is an example of our transition registry, and so we are capturing information. We capture the patient's name, their residence, their service location. Service location simply means the location in which they receive primary care services, their insurance carrier, any attempts that we made to reach that family, because we want to document that we have at least tried to reach them on 3 different occasions. The date in which the readiness assessment was obtained, any goals that we may have discussed with the child or with the parent. If a adult provider has been identified, we want to make sure that we capture that. If an appointment has been scheduled for them for their transitioning, and any type of feedback that we may receive. So this is just how we capture our information in our transition registry. Next, please. The third core element, which is transition readiness. Initially, we received the readiness assessment that was developed by Got Transition, and we made some necessary modifications to ease the administration of that readiness assessment for our population. And so first we determined whether that child or that parent should complete the assessment. And so this is really based on the cognitive level of the child as well as their age. So for example, if we have a teenager who's 18 years of age and they have no intellectual challenges, then we will do that readiness assessment with the teen. However, if that child is under the age of 18, we will do it with the parent. Or if the child does have intellectual challenges, we will also do that readiness assessment with the parent. Calls are made routinely on a weekly basis. We try to make sure that we are calling either, we'll make an initial call today, make another call about 4 or 5 days later, and so on and so forth. And that is then documented in our transition registry. If we are successful in reaching them and we complete it, we will then discuss goals with the family. We will prioritize these goals based on what the teen is capable of doing. That information is then documented in a telephone encounter, because we want to make sure that the primary care provider for that child is aware that this readiness assessment has taken place, and if there are any issues or any concerns that we would like for them to reinforce with them during their visit. So we will send a telephone encounter through our electronic medical record system directly to the primary care provider. However, if we are unable to reach that teen by telephone prior to their family visit, then we will meet them in the actual visit and do a face-to-face readiness assessment. Now, there are some challenges associated with that, because some of our teens, they miss their appointments, they reschedule their appointments, or they cancel. So we have to then reinstate the telephone contact attempts with them and trying to re-engage them to complete that readiness assessment. And as I've already mentioned, the readiness assessment, once it is completed, we will document it in our transition registry as well as in our electronic medical record system. And so next slide, please. So this is our electronic medical record system. We are on the platform of eClinicalWorks. And here you will see where there is transition readiness assessment in the middle of the page. We will upload the information at that point, send the telephone encounter to the provider so they can go in, review the information, and have continued conversation with that teen on a regular basis. We do this on a yearly basis, so 14, 15, 16, 17, 18. We will do that and we will document it in our electronic medical record system as well as in our transition registry. Next slide, please. This just gives you an example of some of the goals that we have discussed with our families. So as mentioned earlier, our navigators, they work directly with the teen or the parent to identify goals. And some of these goals may be that they discuss guardianship and other decision-making options, know when to call or how to call 911. So these are some of the things that we want to make sure that we identify goals for them so that we can discuss them at the next time that we have a communication with them. Next slide, please. This is the fourth core element, transition planning. We continue to engage our families and start the discussion around guardianship, supported decision-making, and power of attorney. Our navigators will help our families determine that level of need for decision-making supports based on their child's intellectual challenges. And I realize that this is not a presentation to talk about that, but I felt that it's important for the listeners to understand that supported decision-making gives individuals with disabilities an opportunity to choose who they trust to assist them in making the decisions, and is closely aligned with the power of attorney because power of attorney is less restrictive and it prevents the young adult from losing all of their rights. While on the other hand, guardianship is very restrictive and it eliminates that young adult's individual rights. So we want to make sure that our families understand the difference between those and know what their options are. Navigators coach families on these differences and provide resources to assist them so that they can make a more educated decision. As part of our transition planning process, we assist teens in identifying an adult health care provider using an adult provider list that we have compiled. Now, we don't have an extensive list of adult providers, but we do have a list of providers, and whenever there are new providers who are willing to take children with special health care needs, we will update that list periodically. Additionally, families are linked to community resources which are culturally appropriate, and it's our bilingual navigators who continue to help us make sure that we have appropriate resources available. Next slide, please. This is the fifth core element, transfer of care. The navigator will assist with identifying an adult healthcare provider and with scheduling an appointment as deemed necessary. To facilitate this process, the navigator works collaboratively with the pediatrician to gather the medical summary and the immunization information and forward that information to either the teen or the parent and to the new adult provider to facilitate a seamless transition. Next slide, please. This is the sixth core element, transfer completion. Once the teen has been transferred to the new adult provider, the navigator will follow up with the parent within about 2 weeks or so to see how that transition has been. And if, in fact, the family is okay with that transition, we will document that. If not, and they want to identify alternate providers, then we will help them with that as well as schedule another appointment for them. So as you can see, we still have a lot of work to do in these last two core elements, but we are working to enhance how we transition our teams. Next slide. I put this in here because I felt that it was important for our listeners to know some of the comments that our parents are making as to why we continue to do what it is that we do. And one on here is that I never really thought about guardianship. Happy that you're doing it. Don't know what my child is able to do. I could start working on goals with her. So some parents, they don't think about what their child is able to do. They're quick to pick guardianship for their child, where in fact they may be able to do some things on their own and only need power of attorney. They may just need some assistance with that. I wish I started the process earlier, or why are we starting this at age 14 years of age? Because by the time the child turns 18, from a medical standpoint, we have to make sure that guardianship or power of attorney has been in place and for making medical decisions, and then of course helping them to begin that process and understand what that process entails as they are transitioning into an adulthood. Next slide. And this is our last slide. And some of our next steps is we're developing training workshops, educational workshops, and informational opportunities using the expertise of our parent navigators to train our healthcare providers and to increase family engagement. And lastly, we have been collaborating with other entities within the hospital to explore how we can make this a hospital-wide effort, because currently it is housed within our Goldberg Center, which is our outpatient community pediatric department. And so we want to spread this so that it becomes integrated throughout the hospital. Thank you for this presentation. And if anyone has any questions, I will be glad to answer them.
Thank you so much, Michelle. That was really helpful. And we're opening up to questions. I have a few here, that you might be thinking about, or questions about writing a policy with the staff, youth, and family. How did she, or how would you customize that readiness assessment? What about creating a plan of care with healthcare transition components? And any questions about DC's Parent Navigator program? So I'm here to hear of any questions that anybody has. We'll give you a little bit of a chance. I think, Peggy, you're on the line as well, if you want to make any comments.
Yes, thanks so much. And I really appreciate that. Here, I think all of you understand that care coordination looks very different from one program, one state to the other. We're really excited that you could hear about DC's Title V efforts and how it supports care coordination through a Family Navigator program in the Children's National Medical System. So I think it's really exciting to see this example. So that was just a big thanks to both Michelle and Jinjay and Patience, and I'll just be quiet and hear what the audience has for questions.
So anybody have any questions, please? I think you should type them in, and we'll wait a few minutes. Otherwise, we'll give you some time back this afternoon. It's a lot that we talked about today, and thinking about how to customize the information and the process to work within your particular system. And I think giving them lots of time is important. So I think we do have a question.
This is Peg again. Let me ask Michelle, could you make any comment about how you went about getting leadership support for your transition efforts?
Yes, sure. Part of our dealing with our families on a regular basis, our parent navigators are routinely encountering issues that our families are dealing with on a day-to-day. And so we wanted to make sure that we take that information back to our leadership, which is our I don't know if you guys are familiar with Dr. Mark Weissman. He is our VP of the Goldberg Community Center, and he has supported this effort from the very beginning. So we didn't have to do a lot outside of informing him about the issues at hand and the issues that our navigators are facing and the importance of providing transition for our children with special health care needs. We work closely with the complex care program, and that complex care program is also dealing with the transition services. And so that is another avenue in which he became aware of the need for transitioning our children from pediatric to adult care services.
Great. We have lots of questions for you, Michelle. First, what training do you have? Do you have the parent navigators go through?
So our parent navigators are, a lot of their expertise comes from their personal experience. However, we do have a curriculum that we have developed for our parent navigators around boundaries, understanding boundaries, advocacy. They participate in community activities. They will participate in other workshops that are offered by Advocates for Justice. As an example, where we were partnership with them, they participate in hospital-wide trainings that focus on advocacy and coaching and mentoring.
Great. We have another question. What kind of training program do you have for the adult care doctors receiving your pediatric youth in transition?
So we are in the process of developing that. So that's one of our next steps in training workshops. And so we have been soliciting information from another community agency called Quality Trust, who does a lot of training around transition. And so we have been working on how to identify ways to do that. That is a next step for us. So we have not implemented those training workshops as of yet. That will be coming down the pike, but we will be using our parent navigators and their expertise to do those trainings for them. Great,
we have more. And now somebody's asking, how are they able to, actually, how are you able to fund the parent navigator positions?
So as I mentioned earlier in our presentation, we receive funding from DC Department of Health, Community Health Administration. We also receive funding from the Maryland Department of Health through the Office of Genetics and People with Special Health Care Needs, as well as the Goldberg Center. And so we receive funds. They are Title V grant funds that support our program.
Great. Somebody's also asking, could you potentially share, I think they said the data collection model referenced in your presentation. I think it's going to be your registry. Could you possibly share that?
Sure, absolutely.
Okay, so we'll try and forward that out to people. Now, do you ever have do you ever have the caregiver and the intellectually capable youth both fill out the transition readiness assessment to compare them?
We have not done that, and it really is based on the teen. If the teen is of age and can decide that they don't want to have their parent a part of that process, then we would not have the parent a part of the process. We will only administer the readiness assessment to the teen. If the teen is in agreement with having the parent there, then we will in fact do that. We have not administered one to the teen and then also administered one to the parent. They are usually done in unison if that is the case. They are done at the same time, and the parent and the child may chime in and give answers, but they are not done separately, so we do not have a way to compare that information.
Great. We have somebody who would like to know a little bit more about guardianship versus power of attorney, and in particular, does the young adult need to be able to give informed consent with a power of attorney? Is this a medical power of attorney?
So there are medical power of attorney. So you can have a power of attorney based on finances, but you can also have a power of attorney which is medically based. So when it comes to making a medical decision, you can have the power of attorney to say only for medical decisions that I want to have someone help me make a decision. And it will carve just out the medical care piece. It won't necessarily include all of the other entities. So yes, you can carve out just that medical piece. And it becomes really important because when the child turns 18, and if in fact they have a surgery that's scheduled, if there is no power of attorney in place or guardianship in place, that surgery can be canceled until that process has been rectified.
Great, thank you. We have some more. So we've got, are the parent navigators hired as hospital employees? Do they work part-time or full-time? And do they have other roles within the sites in addition to their transition roles?
Yes, our 6 parent navigators are full-time, fully benefited employees. They are an integral part of our primary care department. They work very closely with our pediatricians. Our pediatricians feel as though they are part of the team. They do other roles. They do provide navigation services, so they are available to assist with issues around appointments, housing, education needs, immigration needs. It's a whole host of issues that they may come encounter with that they will help our families. So in addition to transition, they do provide parent navigation services. They also sit on several different boards here within the hospital, and they play an active role to provide advocacy for our special needs families. So they may sit on our Patient Family Advocacy Council. They also sit on our ethics committee. They are a part of our Power of One committee here at the hospital. So they are intimately involved in the hospital, and they provide valuable input on how to provide services for our families, and particularly families of children with special health care needs.
Great. We've got a question where somebody has actually developed a readiness assessment. It's going to be part of the electronic record. And she's working through, she or he, sorry, are working to on action sort of steps, tasks for the care coordinators to implement based on the responses where the youth is not ready. And do you have any samples you could share on care coordinator action steps to follow up and assist with the readiness assessment skill findings that you have found out?
We do not have that developed. We took the GOT transition template and made some modifications to that template so that it met the needs of our families, and then we did reiterations of it until it was appropriate for our families. So we do not have any additional resources around that readiness assessment.
Though is it the care coordinator's sort of job to follow through? If somebody didn't know how to do something, would the care coordinator then pick up and try to give that education? I think that's the thrust of this particular question.
So I'm assuming they're referring to the parent navigator as being the responsible party for picking up if something is not done along the path of transition. Is that the question?
Yeah, or you've done a readiness assessment skill and it says, no, I don't know how to make my own appointment. I'm just making this up. And the person who's asked the question, please come back if I'm not pushing the question correctly. It's sort of who then actually says, I see you can't do this, and this is how you do it, or this is what you should do to learn how to do it. I just didn't, who takes the next step after you've done the readiness assessment?
So after we've completed the readiness assessment, we then as I mentioned, uploaded to our electronic medical record system so that it is available for that primary care provider. We will notify the primary care provider that these are the things that was discussed, and we want that primary care provider to take the next step to review those items with that teen or with the family in their face-to-face visit and do that follow-up. Now, we do not have a process in place that will go back and look at what has been discussed with that pediatrician unless the pediatrician sends another telephone encounter to us asking us to follow up with that. We won't revisit that until the next time when we do another readiness assessment on that family.
Great, great. So we have another question here. Would you be willing to share the Parent Navigator's job description?
Sure.
Great. So what we're gonna do is all these documents that she forwards to us at Got Transition will be available on our site, gottransition.org/webinar. So people look there. Now we also have a question about conversations around aging parents. This questioner are finding that they're getting more and more situations where parents may take on guardianship, but then find they are not able to continue care. We've had this happen to young people as young as 19 or 20. So I didn't know whether you're having these kinds of conversations.
We are having limited conversations around that. However, we do have a large number of grandparents who are taking care of these teens or these children with special health care needs and not having identified what they will do if in the event something happened to them. So we have not done, have had an active ongoing process to deal with that, but we are faced with a lot of grandparents beginning to care for children with special health care needs.
Well, great. You have been fantastic, Michelle. We have no more questions at the moment. We have time for maybe one more. If somebody wanted to type in one more question, we'll wait for a minute or two.
Patients, just as a little promo, the next webinar is going to be on the transfer process. I'm wondering, is that on the next slide?
Let's see. Yes, here we go. Upcoming Title V Care Coordination webinars. Transfer April 26th, 3 to 4 p.m. will be transferred to adult care. May 31st, 3 to 4 is integration into adult care. June 28th is youth, young adult, and parent engagement. So the next three there are on the slide that you're looking at. Well, I think we've gotten a lot of nice comments saying thank you, and I want to thank Dr. Lindsay as well as Michelle Jiggets for your wonderful information, and we appreciate it, and we appreciate everybody who is on the webinar this afternoon. Please fill out the evaluation form and join us next time. Thanks so much.
Thank you.
Thank you.